the next speaker is the keynote speaker, Mr. Peter Down. He's visiting us all the way from Missouri. Mr. Peter Down represents an organization called Market Scope. And Market Scope is an organization that is known in the United States for advising pharmaceutical companies, ophthalmology corporations and all on how and what and when to intervene in the healthcare system. So and they are going to be starting a special survey of Indian ophthalmologists compared to the US ophthalmology, you know, the various parameters. So it'll be very interesting. This is the first time we're having a presentation like this in India. So we invited him and he agreed, and he's come all the way from Missouri, USA. In the meantime, I also request Dr. RDR to please come and occupy a chair in the dais. Please come forward. Dr. RDR, please.
Thank you. Good morning, everyone. And I'd like to thank the SETIs for inviting me to launch Market Scope Survey of Indian Ophthalmologists here at the AIOC. That's my, I guess, conflict of interest. I definitely have one. I work for a company that does surveys. So keep that in mind as you listen to what I have to say about this. The survey I'm talking about is, you know, there are lots of different kinds of surveys. This is not market surveys for you on how to get patients, where patients might be. It's not a survey on your clinical results for comparing with other doctors. It's really a kind of a practice patterns survey. Market Scope has done these in the United States for 30 years, and we're launching one in India, kind of, you know, why India and what's in it for you. In the US, doctors use these surveys to benchmark their practice against other people in the same subspecialties, and companies use it as research to figure out what products they should develop that might actually have a market. Doctors who invent new products use them, look at the results to figure out if they're if what they are doing would be popular with other doctors. So here in India, as I have come to these for the last 3 years and traveled around and talked to doctors, I would meet, you know, there are a lot of anecdotes about what people are doing. You know, Dr. Lahan at Sir J.J. Hospital in Mumbai will do 100 cataract surgeries in a day. But, you know, how many surgeons are doing 100 cataract surgeries in a day? And they say, oh, that's a good question. I'll talk to a leading vitreoretinal specialist here in India and ask them, well, how many people are doing vitrectomies in India? And how many vitrectomies are being done? Oh, good questions. Talk to the glaucoma specialist. You know, how many people are actually doing trabeculectomies? Oh, good question. So one benefit of a survey of kind of the profession is to see kind of what's being done across the country and how many people are doing it. It's a way, again, as in the US, to benchmark what you're doing, your volume and your diagnoses, the type of patients you get, with other doctors across the country. And another reason, of course, is companies, kind of Western companies, are waking up to the fact that the whole world is not an extension of the US or Germany, that there are differences in different parts of the world. And they're interested in figuring out how practice differs so that they can gear their products to really be useful to people in different parts of the world. Here's an example from the United States. Adoption of SMILE. SMILE was just approved in the United States last year. I know you've had it here in India for several years. And now after, this is from the third quarter of 2017, so after a year, you see 17% of refractive surgeons in the US offer or plan to offer SMILE. And that has actually started after 10 years of falling refractive surgery. That has actually seem to have stabilized and maybe actually starting to increase refractive surgery in the US. Another thing that is very popular in the US, and I understand probably doesn't have a role here in India, is MIGS. Or as some of you, depending on who you talk to, either minimally invasive glaucoma surgery, micro-incisional glaucoma surgery, or minimally effective glaucoma surgery, depending on your point of view. But it has become very popular in the US. And here we have an example of, let's see, on the left is cataract surgeons. You see what is about 57% offer or plan to offer combined cataract glaucoma surgery with MIGS. And glaucoma surgeons, 66% offer combined cataract glaucoma surgery with MIGS. And one issue that raises particularly for the cataract surgeons, as the glaucoma surgeons like to say, is that glaucoma patients are a very different type of patient from cataract patients. So the practice management has to be different. Cataract surgeons are used to, they see a patient, they perform the surgery, after a couple of weeks or a month, they wave bye-bye, and they never see that patient again, and they don't have to worry about it, usually. For glaucoma surgeons, after you do the surgery, you have a lifelong commitment to that patient, usually. And they may call at 2 a.m., there's a pressure emergency. You have to follow them up again every 6 months for year after year. So it's a very different way to manage a practice. And I think there are maybe some analogous concerns here in India. As I understand, I think 6 months ago, the government started a program to train more and more surgeons in how to diagnose glaucoma and perform trabeculectomies. And as surgeons who haven't traditionally done those start doing those, the issue of the patient follow-up and availability to the patient is going to be an issue in how to manage the practice. The doctors like to see what their colleagues think of new equipment. This is the Zepto from Minosis. I say it's being marketed here at the show. And in the US, only 3% of surgeons are looking at that as a viable piece of equipment. Of course, in the US, everybody's using phaco, and there are a lot of femto machines out there. If we get to femto, femto laser-assisted cataract surgery in the US, this is a year-old slide, but follows a 4-year trend. A lot of interest at first. It's pretty much frozen. Now, at that level, the last slide, still about 50% of surgeons, of cataract surgeons, have femto machines, but only about 10% of cataract surgeries are performed with these machines. Some surgeons do a lot, most do very few. So it's really a machine people are buying for kind of marketing purposes and prestige, rather than for actual heavy use. This is from the fourth quarter of 2017, where we asked surgeons to rank the effectiveness of different MIGS devices. The iStent has been out for 6 years in the US. You see people are very interested in the CyPass as potentially more effective in glaucoma. As I mentioned, people use it to benchmark with the business of their colleagues. What we do with people who take surveys, anyone who takes a survey gets back the results, the kind of global results of that survey. And in this case with India, they'll also get back results from the US, so you can compare with colleagues in India or in the US. But in knowing kind of the differences, having the data for the differences between the two also helps evaluate a lot of medical journal articles or presentations at conferences where they talk about the standard of care, where the standard of care is what is used in the US, and it may not apply here in India. This slide was out of order, actually. If you go back to the slide on MIGS, and we talked about all the people considering doing MIGS in the US, and this kind of gets to the point of the practice management. Because in the US, 69% of cataract surgeons, 56% of glaucoma surgeons are in solo practices. And so particularly for the cataract surgeons, they're at 69% in solo practices. If they start doing glaucoma, that's a big issue. Who's doing that follow-up in glaucoma? And if maybe, hey, they have relations with a glaucoma specialist they can refer a person to after the surgery. But we're doing hundreds of thousands of these MIGS operations a year. After a while, that glaucoma specialist might get full and not take any more. So that's the issue there. And of course, it's relevant to the earlier discussion here on solo versus group practice, because you don't really have the same issue with patient management in a group practice if it's a multi-specialty group practice. You do the surgery, you probably have involved the glaucoma specialist before you do the surgery with the patient, and the practice as a whole can follow up that patient. We looked at the trends in practice plans in the US. As you see, whether you're new to group practice, you're going to sell, you're going to join others. And even though, as you saw from the last slide, most doctors in the US are in private practice, they're looking for partners. And that's, I guess, one way to grow, one way to get a group practice is to grow it yourself, starting from a solo practice, and then bring in partners. So our survey, I invite you all to fill it out, to participate with us. It's an online survey at practicescope.com/India, and that's practice-scope. I think I made a mistake earlier telling somebody I left out the hyphen. So remember, it's practice-scope.com/India. And this is kind of the landing page, or well, I guess, let me back. This will look like when you go to the website, you'll land on that page, and you register with your name and email. It is mobile friendly. You can do it from your phone. It's treed, so when you tell the survey what kind of ophthalmologist you are, whether it's a general or a subspecialist such as cataract or refractive or retina or glaucoma, it'll direct you to questions related to that subspecialty. The information you supply is confidential. All the data is de-identified. We verify that people who answer the survey are ophthalmologists or practice administrators. And again, its focus is on practice patterns. So number of patients you have, the diagnoses you make, the equipment or medicines you use, whether you're using medicines or surgery in response to different diagnoses. So thank you very much. I appreciate the chance to talk about this here, and I want to thank the people at my company who have prepared all this.
Thank you very much, Mr. Peters. Thank you so much. Kathleen would like to say something about the scenario which he said.
Oh, I was just going to ask a quick question. Do you have a feel for what percentage, Peter, of cataract surgeries or glaucoma surgeries are done in solo versus group practice as far as volume goes? I know those numbers exist, but you may not have them on the top of your
head. I don't have them off the top of my head. We do that. We have the solo practices, we group practices, and then we have, I think, kind of 4 segments of volume that people say, oh, I do maybe 25 a week or less, or 26 to 50, or 50 to 100 and over 100.
Any other questions from the audience? I just have one question that there are a lot of regulations which your health system puts into your practice. So how does your decisions about all this go? Like every time there is a fresh regulation, whether you can use a drug, you cannot use the drug, and the financials and the insurance. So I mean, is it different for solo practice and group practice?
The regulations, what you can use or not? No, I don't believe so. They have, and the nowadays, and I'm sure Dr. will agree, a lot of the regulations on what you can use or not use are actually coming from insurance companies, not from the government. They usually tell you what you can use first, and if that doesn't work, then you can go on and use something else. And there's paperwork and documentation you have to do to explain why you're going to move on to something else. Yes, but it's the same rules whether it's a solo practice or a group practice.
I just want to encourage everybody to get online and enter data, because that data, market scope data in the US, we use that to answer so many questions. It's such a great service and resource for us. And so that, along with that loose benchmarking, really can answer so many complicated practice management type questions that give you ideas about how to move forward in the future.
Yeah, certainly. Any of you have been to the AAO in the U.S. or the ESCRS in Europe have seen slides quoting market scope data, probably several times during any meeting. And I've actually seen a few of the slides quoting market scope data here at the AIOC. So it is something doctors use in planning